Hello everyone and welcome to today's Michigan Medicine live event. I'm Ed Bottomley with the Michigan Medicine Department of Communication, and I'm here with Doctors Rebecca Cunningham, Patrick Carter and Marc Zimmerman, all of the professors here at the University of Michigan who together lead a new effort to study the issue of children, teens and firearm-related injuries and deaths. Their program is called the FACTS Consortium, and FACTS, FACTS, is short for the Firearms Safety Among Children and Teens. It's funded by the National Institutes of Health and includes researchers from across the country. Doctors Cunningham and Carter are both trained as emergency physicians, and Professor Zimmerman specializes in studying resilience and violence prevention among teens. They clearly state on the FACTS website that they're dedicated to reducing child firearm injuries and deaths while respecting gun ownership as an important part of the cultural fabric of the US. Just a reminder, for this Facebook Live, you can submit your questions at any time, even now, for our panelists to answer during the Q&A portion of today's event. Questions can be submitted in a number of ways. You can comment on this video, but please note that your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can also send a private message to us via Facebook, or you can also email us at mishmedwebchats@med.umich.edu. If you can't stay for this entire chat, if you'd like to share the recording of this chat with a friend, a video of the chat in its entirety will be available on our Facebook page, and we'll be putting it up on the Michigan Medicine YouTube channel soon after that too. So let's start with some of our questions. Question number one. Just how many children die in America every year from firearm-related causes, and how does that compare with deaths from other causes?
Patrick, you're the data guy.
So thank you, Mark. In 2017, there were about almost 3,500 deaths from firearms among children and teens in the United States. About almost 60% of those deaths were due to homicide. A little under 40% were due to suicide causes, and about 3% are due to unintentional injuries, or what has traditionally been called accidental injuries. Looking back over the past 10 years of data, firearms have been the second leading cause of death among children and teens in the country. And if you look at kind of trends over time among the leading causes of death, we've made substantial progress since the 1950s in reducing motor vehicle crashes, which have been the leading cause of death among children and teens, and significant progress in reducing deaths for cancer-related causes, which is the third leading cause of death. But specifically, since about 2003, our progress in reducing firearm deaths has been pretty much flat. And over the past several years, we've noticed a little bit of an uptick in the deaths due to firearm-related injuries.
Thank you for that. The next question, can you break down the types of firearm deaths among children and teens? How many are what people might call accidental compared with those that are on purpose, either because of an action by another person or by the person using the gun?
Yeah,
And
you guys can feel free to chip in as well.
Sure. But you just sort of
I just sort of point that. So, like I said, about 60% are due to homicides or intentional injuries, usually due to interpersonal violence, and a little under 40% are due to self-inflicted injuries or suicides, and about 3% are what has been traditionally called accidental injuries, but we like to term unintentional injuries that are preventable.
I would add just a couple things to that. I think between 2016 and 2017, we see these rates going up. Actually, from 2013 on, we've seen an uptick. And from 2013 to 2016, we've seen about a 32% increase in gun homicides among adolescents and children, about a 26% increase in gun suicides among adolescents and children. And we know now in 2017, we see among those 13 to 17, among all those teenagers in the country, it's actually the leading cause of death among all of those children. And about 1,800 children under the ages of 18 die every year by firearm in our country. And when we think about that more broadly, Our mass shootings that have gotten a lot of visibility have been horrific. 1,800 children is actually wiping out an entire high school every year.
That really puts it into perspective.
Yeah.
What about the injuries? We always talk about deaths, but the injuries
Sure.
are even.
Yeah.
So
we don't have quite as good data on
Right.
On non-fatal, what we call non-fatal injuries, so firearm injuries that don't result in deaths. But the best data we do have suggests there are probably around 20,000 non-fatal firearm injuries every year across the country. The majority of those are due to either firearm assaults, interpersonal violence, or due to unintentional injuries. The lowest number are actually due to self-inflicted injuries, and that's primarily because when a self-inflicted injury is so fatal. It's the most lethal form of firearm injuries, because about 90% of those who try and attempt to kill themselves actually end up dying of a suicide injury.
So to use your metaphor, that would be about 10 high schools worth of kids are injured in some way from firearms every year.
And those are just the numbers for children.
Yeah, those
Right.
are
Children and
just for
teens
children.
and
Right.
adolescents.
This is a question, I think you guys have all touched on this a little bit already, but let's ask it again. What's the general trend in these deaths over the last 20 years? How does it compare to trends in other types of deaths in teens? In children's and teens.
Sure. Well, I'll start that one off.
Sure.
So in motor vehicle crash, we've seen this tremendous decreasing curve over the last 2 decades of decreasing death among children and teens due to an overwhelming amount of resources and prevention and tireless work by scientists thinking about how to keep kids safer in cars. And the same with cancer deaths, which is the 3rd leading cause of death. Really tremendous improvements in that. For firearm injury, it's really been a very flat line over the past 17, 18 years, with this uptick that I've talked about since 2013 that we see continued through 2017. Really with not much improvement at all over that time.
The next question, is there any kind of death that's gone down? And if so, why is that?
Well, the car crashes.
Yeah.
Have notably, and I just wanted to add that we often think about the technology activities that kind of help car crashes go down. Safer cars, the safe technology that we have in cars, better lighting, better roads. But there's also a behavioral component to that. How parents can be more effective teachers to their kids, and then other activities around the kids and drinking and driving and some of the risks that they might go into. And so the same thing, the same kind of both technological as well as behavioral interventions and prevention can
be applied
to firearms.
That's very interesting. We've got a question from a Facebook user. They're asking for some clarification about the 60% of gun-related deaths in children and teens that are homicide. They ask, is there a breakdown of socioeconomic data?
Do you want to?
Well, I would start out by talking a really important point being that we know that those rates of death, which are about 4 per 100,000 in youth between the ages of 1 and through the age of 18 and 19, that those rates of death are very similar across all of the communities that we live in. So that rate is very similar, and even for rural areas, for suburban areas, and for urban areas. We know that children are dying at about the same rate in all of those communities. And so this is a problem for kids across our communities.
The underlying intent behind the deaths that occur in rural and suburban and urban communities it may be different, but the rates are pretty much the same across the board.
Interesting. The next, we've got another Facebook user question. They say they're a gun owner. We will reduce accidental children deaths by charging the parents with murder if their kid dies. Can you comment on policies that penalise the gun owner, especially a parent or other responsible adult, if a child uses a gun?
So there are laws that are out there called Child Access Prevention Laws, or CAP laws. Not all states have those laws, and what those laws do is sort of along the lines of what the user is suggesting, which is holding an adult responsible, typically a parent responsible for a child having access to a gun. We know in general that those laws show some promise for preventing death among children. They're not applied evenly across states, and in some states the law may only apply to children as young as 4 or 5. In other states it may apply to holding parents accountable for children up to, say, 11. But there's a lot to yet be understood about what is the optimal age for that, and how that accountability should be held. But there is some promise for those laws.
And I would just add, I think it was mentioned already, but they're not implemented evenly across the board. So there's a lot of work to be done on understanding how best to implement these types of laws in different states, and to see what's most effective in doing that.
And when they're on the books, they're not necessarily enforced evenly across either. So there's much work to be done there around culture, and that was a little bit, I think, what Dr. Zimmerman was referring to around cars and behavior. And there's been a lot of change in our culture also over the last 20 years in terms of expectations on driving and drinking and things like that, and ways that we've educated our teens to think differently about that, and safety around cars. And that education is part of a broader way that we think about cars in the culture now, and that safety culture is something that can also be more of an active conversation with children and teens around firearms.
I'm just on that car thing, even when you think about people don't get into cars anymore without buckling their seatbelt. Mm-hmm. When I was a kid, maybe you did, maybe you didn't. They didn't go across your shoulder. That's how old I am. But it's a simple. We keep bringing back this notion of using cars as sort of a point of comparison, and I think that's a good one to think about, because there's the multiple levels of both influence and points of change or intervention that would be.
And I might just add to that we have more cars on the road now than we ever did, and more people are driving more miles, but we've decreased the incidence of crashes over time. And so we can do the same thing with guns. People can still own guns responsibly, but we can decrease the potential for injury from them.
Very important. Thank you for that. Question 7. When we hear about a massive tragedy, such as a shooting at a school or a church, we might think that these mass shootings account for a large percentage of deaths of young people from firearms. But where do such incidents fall in the types of firearm deaths in kids and teens?
So the mass shootings of the type that are most on the news, these horrific school shootings that we've seen, account for about 1% of the total deaths among children and teens for firearms. They have done a lot to raise awareness as a culture, and I think for us to think about that these events can happen anywhere, that we're seeing people now, adults shot in yoga studios and in churches, and children shot through what should be the routine course of their safe activities and going to school. And those are really important, I think, to highlight for all of us that this is an issue that needs to be addressed. But noting that most of the firearm injuries and deaths that happen across the country are not in this mass shooting context, and are in the context of either these unintentional or accidental shootings that happen, or in the context of interpersonal violence and or suicide-related attempts and fatalities.
The next question that we have, teen suicide is part of this whole discussion about firearms. You were able to see the specific causes of all kinds of suicides. What's the role of firearms compared with other means, such as overdoses?
Well, it's something like 90% of suicide attempts that are successful are firearm related.
So when you look at what are the causes of suicide, so firearms are the second leading cause of suicide. And the one that falls ahead of that is actually suffocation. But the key point that I think Dr. Zimmerman is bringing up is that if somebody does attempt to try and kill themselves with a firearm, 90% of the time they're successful. Whereas if they try and overdose on, let's say, opioids or pills, the percentage of times that they will be successful and not get to the hospital and get some help that they need is much lower. So it's the availability of a firearm in that moment that's so lethal. And we know when we talk to folks who have survived attempted firearm suicides that the majority of them don't go on to kill themselves. And the majority of them say that they planned for less than 5 minutes at the time of the event. And it was the availability of a firearm in the home or in the home of a relative at the time, about 75% have access to a firearm, that led them to be impulsive and to attempt to kill themselves.
It's a dangerous mix of the brain is still developing. Impulsivity is more likely to occur when the frontal cortex is less developed. And with that impulsivity and access to significantly more lethal means is a very
dangerous
bad
mix
of risk factors. Which is why it makes it even all the more important when we think about kids and accessibility. Because often suicide among kids is a very impulsive act.
Mm-hmm.
Yeah.
So there's this real myth out there that if it wasn't the firearm, it would be something else, and that the suicide rates would be the same. And that simply hasn't been found to be true. We know if there's not lethal means right there. And in fact, with the rates that were going up in suicide over the past couple of years that I mentioned from gun suicide, the non-gun suicide rates actually increased 15%, where the gun suicide rates went up 26%. So that easy or access to lethal means in an impulsive moment is really the deciding factor. And so if we reduce that deciding factor and have that firearm instead stored safely away from teens that are impulsive or depressed, then we decrease that fatal wound often.
And the key is sort of firearm access in that really high risk time, and how do we decrease their access to to an unsecured firearm.
I just want to also just mention that the key to all of it around depression and suicide is recognizing signs early and prevention in the first place, so that kids are getting the kind of attention and services and help that they need to cope with their depression, to cope with that impulsive kind of behavior and that sort of thing. So we don't want to kind of lose the idea that firearms or not, adolescent suicide is a significant issue that's a preventable problem that we have to think about too, even outside of the whole gun debate.
Absolutely. Thank you for highlighting that, and thank you for your answers as well. The next question, there's an incident in the news actually right now about a 4-year-old who shot his pregnant mother with a gun that was in the house. How many such incidents happen each year where the child fires the gun and an adult is the victim?
We don't really have. Do we have specific data on that?
So we know that it's not uncommon for children to have, for young children, often in this preschool age to and early adolescent age, to have a firearm and accidentally shoot either a playmate or someone else. Those deaths from where the death is the child, is the other child or another teenager, is about 100 a year. And the numbers altogether in the population are about 1,000 a year of either adult or children are fatally shot by an inadvertent, somebody finding a gun, playing with it, the teen not realizing it was loaded when he was showing it to his buddy, the toddler being curious with it. And that's a really important tragic event this week. It's an event, as I said, and on average in a year we'll see about 100 of, if we do nothing different in our culture around firearm safety. And that's the statistic that we've seen every year before this for the past decade or 2 decades. So there's not a real reason, unless we really change our mindset around this, to think that we will see anything different. And the things that come to my mind with that toddler are sort of the question your viewer asked before, which is, in our society, whose responsibility is it to make sure a 4-year-old doesn't have access to a loaded gun or can't find a loaded gun, is one. And two, why does a young family feel the urgent need to have a loaded gun under their mattress? And those questions I don't have easy answers to, but I think we as a culture need to spend a fair amount of time thinking about deeply and addressing both of those root causes.
Absolutely. Another question we have from Facebook from one of our users about parents who choose to teach their children about firearms, what do we know about the effects of teaching children about responsible handling of firearms and the impacts on the risk of firearm injury or death?
So I could start, and then I think I'll hand off to you. So I would say education is critically important, and families and gun-owning families and non-gun-owning families all need to teach their children some basics about safety around firearms, what to do with one, how to handle one safely if you have one around, how to keep it locked safely and stored, when is an appropriate time to touch it, i.e. not an adult there. All of those things are critically important, and there's a number of programs around to help with that education. Education being really important but not sufficient. So none of the education programs that have been out there now have shown to demonstrate that a young child especially can get over that impulse of then reaching out and touching it. It's like the young child not reaching for the chocolate candy. They can tell you that they know they shouldn't touch the chocolate candy, and that is where the education comes in. They can't necessarily resist that impulsive urge. And so the education is really important and may help with some aspect of it, but isn't sufficient instead of having them locked and safely stored away.
Yeah, I mean, I would just echo that. So the evaluations that have been done on the programs that are currently out there haven't shown to be effective at preventing kids, especially young kids, from accessing a firearm. So really the number one message is if there's a firearm in the home, that firearm needs to be stored in a way that it's safe and secure and so that a child can't access it.
Thank you for that, very important. So far we've in the main been talking about deaths. Do we know how many children and teens are injured by firearms each year? And if not, why not?
Well, no, we talked about 18 to 20,000.
Yeah, it's about 18 to 20,000. Unfortunately, the data that we have on non-fatal firearm injuries that end up in emergency departments is not the best data. The fatality data is what's called a census, so it's an actual count of every death. The data that we have on non-fatal firearm injuries is a probability count, so it's an estimation based on what we know from a small number of emergency departments. And so our data there is not quite as rigorous, and it's certainly one of the areas as we look at what can we do around investigating and understanding firearm injuries further is we need better data on the people who show up to emergency departments with injuries.
And another thing just about injuries that makes it even more difficult is what we don't really have a very good handle on is what effect that has on their psychological well-being if they've been victimized, or the psychological well-being of the people around the injured person, so their friends or their family members, and how that plays itself out. We know, for example, that injury or experiencing violence, even just witnessing violence, witnessing a shooting in a neighborhood, in your neighborhood down the street, has long-term physiological and psychological effects 10, 15 years later. So that's a whole level of injury that we have less information about. We do know that it has significant effects on school. When there's a school shooting, mental health professionals swoop in to provide services to all the kids, all the survivors. And we don't spend a lot of time talking about the survivors, the whole idea of secondary prevention. Mm-hmm. So just wanted to
the definition of injury is not just limited to the actual injury from the bullet. There's an injury that's much broader than that, as I think what Dr. Zimmerman's alluding to.
Yeah.
Right. And not just the specific victim is the other point.
So in terms of research, what kind of research is most needed? What do we most need to know about children, about teens, about firearms?
Well, we've just spent almost a whole year looking into that question. Yeah.
Could you answer that?
Right.
So, I mean, we know everything from basic epidemiological research on who's getting injured and why they're getting injured and the context around which they're getting injured, to better research around primary prevention programs. How do we prevent these incidents from happening in the first place? As an emergency physician, I feel like once I see somebody come into the emergency room with a firearm injury, we've failed them in a way because we haven't done the work up ahead of time to prevent that injury from occurring in the first place. And there are a lot of things we can do, but we don't understand yet what works. And then in addition to that, after somebody has suffered a firearm injury or has witnessed a firearm injury, all of the subsequent injury related to that, we don't know what all those effects are or how do we prevent that. All the mental health complications, we need a lot more better understanding of that. We know that kids who suffer a firearm injury, when they go home from the hospital, about 50% of them have lifelong physical or mental injury related to that affects them for the rest of their life.
Yeah, I mean, that's just the tip of the iceberg. We get really nerdy and talk about different ways of measuring it and how do you assess it, the kinds of samples we study. So I don't want to get too nerdy methodologically, but there are a host. I mean, we haven't really had federal dollars focusing on the kind of information that we need to really do prevention in the last 30 years. And the limit of those dollars in that research has limited our knowledge to know exactly what could be, what are points of intervention. The other thing I just wanted to also point out is, and a lot of the conversation has been around the risk factors and sort of what's wrong, but we also need research on what's right. What are things that prevent a kid who feels depressed from hurting themselves? Or what prevents, what are the positive factors in a family where the safe storage does occur? And so we need that kind of research as well.
I think also the analogy with motor vehicle crash here, is illustrating is that we spent 50 years to get to the point where we are with motor vehicle crash, with interventions and testing and understanding the data and studying it and intervening. And if we had the type of resources applied to this problem that we've applied to the problem of motor vehicle crash injury or cancer deaths, that could have the similar impact in terms of the...
I'd almost guarantee it, actually. You've been trying to say something, Dr. Cunningham?
So I think if the other analogy, and you started to touch on it there with cars, if you think about what you brought up, which is we hardly know for sure exactly how many children and teens, or adults for that matter, are getting shot every year. If we think about a cancer and we're trying to cure the cancer, and we barely know how many people have gotten the cancer that year, there's a whole host of questions you can imagine we would ask after you knew exactly how many people had gotten that cancer as to what might work to help cure that cancer, what the small things, what the big things are, what the family things are, what the community influences might be. All of those questions need to be answered as we start to dig into really scratch the surface of the science, which there is a science to this. There's a science to firearm injury prevention, the same way there's a science to all the other kinds of injury prevention that we do. This isn't fairy dust and magic and magical thinking here. There's science questions here and science-related answers and research that can be done, but that surface has really just beginning to be scratched.
Right.
So when you ask the question about what do we need to do for research, we need to do everything across the board.
Everything.
And it's possible.
Yeah. And it is possible, actually. Right. I think that's the key. I mean, we do have models of injury prevention that could fit here, but we need to have information so that those models can be applied appropriately and tailored appropriately. And the lack of research has been a real issue.
The lack of research has been a big issue. And when you apply those injury models, though, we had a lot more children dying in house fires 30 years ago, and then the science of smoke alarms got better, and we taught families to install smoke alarms, and we taught them on a certain day every year to remember to change the battery in it, and we taught kids what they meant, and we addressed smoking inside the house, and all these different things. And with that, we have a lot less children and teens dying of fires in houses than we did 30 years ago by applying a basic science technique.
Yeah, thank you for that. We have another question off the press on Facebook about gun violence and violence in general that affects children who don't have a father in the home or spend only weekends with fathers. Are there data on the risks of death or injury among children in different family structures?
Well, I can just speak to that more generally, not specifically my research, and I'm not aware of any research that looked at this issue specifically to firearm injury, but it's not about the family structure, it's about the family process. And what by that I mean how we interact with our children, how we treat our children, how we behave in front of our children is almost more important than who's necessarily in the home. One of the things that we have found, for example, is that absent fathers let me say it in a different way. Single mothers does not necessarily mean absent fathers. That fathers can be and are engaged in kids' lives. And so just because they don't sleep with them in the same house all the time doesn't mean that they're necessarily absent. So I think that's an important point about that. So I'm not sure it's the right question. I think a more important question, we do know that adults and parents play an important role in kids' lives, regardless of their age, the age of the parents or the age of the child, actually. There was a debate in developmental science about, well, as kids get older, their friends matter more and their parents matter less, and it's not a zero-sum game. Yes, the kids may start to matter more than they used to, but parents are still important and still play a key role. And so if you take some of that science that we've done around the role of parents and adults, wherever they live, and apply that to firearm injury and death, there's no reason to think that it couldn't play an important role. But where the father lives is not as important.
Thank you for that. Let's talk a bit about you guys. Let's talk about what motivates you as researchers. So Doctors Cunningham and Carter, you've both worked in emergency rooms. Professor Zimmerman, you've worked directly with young people in the community. Why are you guys driven to study this issue?
So I'll start. I think as an emergency physician, and Dr. Carter touched on, I take care of, for many years, many youth and adults who arrive in our emergency department in our trauma bay and are either very ill and or dying from that firearm injury. And I've been very motivated to see what we can do before the trauma bay to try to keep them out of the trauma bay, because once we know that firearms have so much lethality to them, that after that shot is fired, what we can do for them medically in the trauma bay is really going to be very limited. And if we're going to really make a substantial impact, we need to work before that and work on the prevention end.
Thank you.
And I would just echo that. I think I already kind of said that earlier.
Yeah.
Well, given that I'm not a real doctor, I don't. Actually, really kind of grew out of the work that we've been doing, working with youth violence prevention in general, and looking at the social relationships and the social context and the environmental context where youth aggression and violence kind of generates from, and some of the factors that play themselves out in terms of protecting them from those influences or making those influences worse, so those risk factors worse. And it just became abundantly clear the more we did this work that these were all similar precursors to the ultimate use of a firearm in some kind of these activities, and they also rooted in the same place. And the frustration around there was almost gag orders about what you're allowed to talk about and what you can talk about by some funding sources, that it's a very frustrating thing where you can't keep climbing up the mountain to really try to understand that. So that's kind of came out of, basically for me, more out of the research and the work that we've been doing with kids.
Absolutely. Thank you all three for that answer. So you've gathered researchers from around the country to study these issues and also to offer free online education tools for healthcare providers and others. Can you talk about who you have working with you on this effort, including your advisory group?
Sure. So we have a mix of about 25 senior and junior investigators from around the country who are research investigators who are engaged in this consortium, and they're from a variety of different universities. And then knowing that firearms are somewhat of a controversial issue, we recognize that similar to studying cars, you can't study a car unless you understand what the issues are that the driver has. People who own guns are an important part of the discussion and the conversation. And so we put together an advisory group that is made up of folks who are gun owners, who are gun trainers, who are sportsmen, who are people from the community and education community who have an interest in understanding this issue and contributing to the work that we're doing. And they've they've been a very extremely valuable part of what we've been doing because they've been able to provide an input and context that is apart from what we get from academic folks who are doing research, but folks who are really engaged with this at the ground level.
And just to be clear who we are, I don't mean we, I think the we in that sentence is FACTS.
Right.
Is
Yeah.
the FACTS Consortium and the work that we're trying to do to
We
identify
also,
these areas.
And we also have our team based here at University of Michigan, but is engaged with 12 other universities around the country, east and west and north and south, and kind of a broad perspective of life across the U.S.
And medical researchers,
Public health.
public health researchers,
Criminology.
criminologists. So it's also interdisciplinary. So it's not just
Law enforcement.
not just spatially diverse, but also topically diverse, because we're really
Great.
trying to get a handle on kind of the gaps and trying to help fill those gaps.
Absolutely.
All sort of with a really clear unified goal of we just want less children and teens dying by gun violence and being injured by gun violence. And that's, if we hold that truth to be together amongst us, we can cross a lot of different languages and a lot of different concepts and cultures.
I think you said before that there's no gun owner who wants to see a 4-year-old or an adolescent die of a firearm injury. So if we can all sort of coalesce around that as a goal, we can make progress.
That's the common ground, because that's what it's about. Full stop. Is getting that 100 a year or 1,000 a year or 3,000 a year, whatever all the numbers we were talking about. The goal is to get that to zero. It's probably idealistic, but a goal of reducing it 10% this year, 10% next year. Or I think
We did it with car crash, and we did it with drowning, and we did it with fires. We reduced deaths by 50% of those children over the past two and 3 decades. So.
Wow. Next question, what is the role of doctors, nurses, social workers, psychologists, clergy, and even teachers and youth sports coaches in all of this? Can you offer them something now to help them address firearm risks with young people and their parents? What about cities and other municipalities?
Sure.
We-
So I think
we'll all have
big
something to say
Yeah,
about
we'll all
this.
have
It is a
something to
big
say.
one. We'll all take a turn on that.
Yeah.
Sure. So everyone has a role. I think obviously this is all of our communities. These are all of our kids. We all have a role in doing something. I'll start with the doctor angle, and I'll let you go from there. So physicians have been a source of trying to keep families and children safe and their patients safe for our entire profession, essentially. And that's been a common part of the language with families and with kids around car seats and around hot water, how hot the temperature of your bathtubs should be, and about having smoke alarms. And so I think physicians, we've really seen over the past year, have kind of found their collective voice in the U.S. and really come to see that they certainly do have a role in preventing firearm injuries among children and kids, for sure. And that this is part of an active discussion that we can have with families, respecting all of their rights and helping them think about how firearms in their house can be stored more safely and kept more safely, and what we can be doing together to think about that. So.
Yeah, and I mean, I think physicians have a key role, as I think Dr. Zimmerman was saying earlier, in identifying kids who are at risk for mental health issues or depressed, and how do we address firearms in the home, especially during that high critical time, or young kids, if there's a firearm in the home, how do we address that? And so I think, addressing the issue specifically of firearm access among those families and those kids at those high risk times is really key, and I think everybody can play a role in doing that.
And just thinking about roles, for example, of clergy or sort of non-professional types. We have interventions that are called like mental health first aid in schools, where we're trying to train teachers and staff to recognize changes in behavior and recognize when somebody might need some help but who isn't getting it. Things like starting to give away all their things, the death talk and hurtful talk, or real significant changes in behavior. All of a sudden they're not, as talkative or as engaging, or they're sitting alone more often, and recognizing those and getting early help. And that's a role that teachers, that clergy, that coaches could play. And again, being the nerdy guy on the maybe, they could also play a role in helping do research, helping gain access to settings to do some community-based work. So whether that's a nurse or physician or people in schools, that creating those opportunities to do the kind of research that needs to be done, so that we know what works or what doesn't work.
Yeah, I mean, I think school nurses and teachers, anybody who's really interacting a lot with children and teens and are around them, have the opportunity to see when something isn't going right and really be paying a lot of attention. And then also adults, we know one of the most things that helps youth the most, separate from their parents, is positive role models in children's life. And so to the extent that your coach is often the biggest positive role model for many children and teens across the country, those relationships are critically important, and critically important in helping kids get through bumpy times.
Thank you for that. Thank you for that answer. So we've got another question from Facebook. Is there a geographical tendency for firearm incidents, types, trends, etc.?
I think we talked a little bit about this earlier, which was that if we look across the spectrum of rural and suburban and urban America, we see that really firearm deaths rates in all of those settings is pretty much even across the board. The underlying intent that we see behind those firearm injuries differs a little bit in context. So homicides tend to be a little bit more common in urban settings, and suicides and unintentional injuries tend to be a little bit more common in rural settings. But ultimately, at the end of the day, and if you're talking about numbers of fatalities in those settings, they're even across the population in terms of incidents.
Fascinating. Thank you. Another one new from Facebook. We've had a question about suicide deaths in particular. Do we know from data on the different means of suicide enough to conclude that attempts made with firearms are more likely to result in death?
Yes.
we
know
by
that
a wide margin.
By a wide margin.
Yeah.
We know that suicide attempts by firearms are somewhere in the realm of 90% completion, and every other mean beyond that is substantially less than that by an order of magnitude or two.
Thank you. There's a lot of public polling going on about what measures Americans support or oppose when it comes to laws, regulations, and policies around guns. Is your research driven by a certain point of view about these matters? Are you setting out to support certain changes in public policy? And are you studying what is happening when policies change in certain states or in certain cities?
So we'll go with the latter.
Yeah.
Well,
So our job is not to have a particular agenda here at all. We're about looking at the data, trying to sort through this mountain of data that we either have hardly collected at all yet or are just beginning to analyze and make sense of that. And we will go with the solutions to where that data guides us. There are, in the meantime, Americans are desperate for solutions around this, and policymakers are passing laws. And as those laws get passed, it is important to do analysis of those to try to understand how those laws may be impacting injuries and deaths. And we are looking, as laws get passed, what happens, but we're not in the business of driving necessarily a particular viewpoint or agenda by any means.
And I would just add to that, and it's not just, is this law effective? Is this component of the law effective? What parts of it are effective? How is it implemented, and is it enforced? And what are those key components that need to be done in order to have that actually have the effect that we're looking for on injuries and deaths?
I would disagree. I think we do have a particular point of view, and that is reducing the number of injuries and deaths due to firearms. That, I think, is the common ground and common point of view. I mean, we're not advocating for any one thing, and I think it's really important. What Patrick just said is really important, and that is not all laws are created equal. And not all laws are implemented equally. So even if they look the same, they may on the ground be implemented in different ways. extreme protection laws, for example, we do know that they do differ across states. There's 10 or so states that have it, 10 or 12, but they're pretty different. We don't know how the differences make it, if they make a difference. So I think that is a really important point. And it isn't about one point of view or another. I mean, if none of them work and they're implemented to the letter of the law, literally, then we have to rethink about what we need to do to make it work to reduce those numbers. I think that's the bottom line.
I think, and with the kind of underlying understanding that with that, we don't anticipate that there will be less firearms in the country over the next decade.
Right.
So I think that's nor am I going to drive a horse and buggy any longer. We have cars and we have guns, and those are going to remain well within our households, and we don't anticipate there to be changes in that within the realm of the work that we're doing. But understanding those facts, what can we do to make this safer?
Absolutely. The next question we have from Facebook: how can we go about regulating firearms? What would be the issues or difficulties in regulating firearms and creating a system like we have for getting a driver's license? And what are the steps we're taking currently?
I think we're very much at the beginning of that question, and I would say we're ahead of ourselves in some way from a research standpoint and a data standpoint. There's more to be learned in terms of what policies might work. There's wide support for example, in the country, and the House will be debating later on this week background checks. I think 70 or 80% of the country supports some version of that. We have more to learn there about that.
Think
and we need the data to drive us.
Yeah. I think the question goes to what we said earlier, is that's part of what do we need to study to understand how we reduce child firearm deaths. We need to understand what the best components are of these type of interventions.
Yeah, so far for me, the two main themes are ones that I've said already, which is what the common ground is, and then the other one is we need sort of more resources, more support, more data to be able to answer a lot of these questions. I mean, it's frustrating to be, we're competent researchers. We kind of know how to do this kind of research, but research is expensive, and we spend a whole lot of money on all sorts of relatively rare diseases, much more than we do on firearm injury and death, especially among kids. So I think that would be something.
Yeah, so I think if you're going to get to the what should we do, around regulations, those answers will come, with a mountain of data that needs to be that we need to work through, and that will come with research. That will generally not come by us sort of sitting around going, "What do you think,
Right?
Mark?
Yeah.
And Pat, do you think we should do this?" That's not really the way we came up with seatbelts.
Right.
We didn't sit in a room together and go, "I think the seatbelt would work best if we put it across this way." We tested them on mannequins. We tested them on people. We tested them in
computer
cars.
simulation.
In fact,
We
across
did
the street.
across the street here at
At
Umtree. We
Umtree.
did a lot of hard research studies for many years, and that's how we found out what actually worked. So if we're going to find out what actually works, we're going to have to do a number of research studies, and we're beginning to do that work, and our colleagues in this consortium are beginning to do that work, and people are really anxious, and I know they want the answers to that right now, and our country needs to invest a lot more if we want to have those answers. We invested billions of dollars to figure out how to decrease the death rate in cars. We're going to have to invest if we really want those answers. They're not going to come magically out of the sky. Yeah.
Thank you. Very important. Your program includes some jobs for young researchers who want to base their own research careers around studying firearms. Why is this important?
It's important to build the pipeline. Due to some of the challenges around funding in this issue when we started the consortium, I believe there were maybe 12 senior researchers in the country that had careers focused around firearms. And so, and those folks, as they get closer to finishing their careers, there needs to be the junior researchers that come behind them that can continue that research, and all that institutional knowledge about how to do the research, I think, is important to convey to junior researchers. So that's one of the key goals with the consortium, is that we have a mix of senior level researchers and more junior level researchers, and we're training new researchers as they come up through the pipeline to do this kind of research and to be able to have long-term careers focused in this area.
It's directly related to the funding issue, right? I mean, if there isn't sort of attention paid to this, or if there isn't enough people doing this kind of research, then we don't do the research. So we need more brains. We need a lot of brains to work on, just like we need a lot of brains to work on cars. We need a lot of brains to work on firearm injury and death. And it's at every level, at the practice level, at the research level, at the treatment level, every level.
Well, I think there's really good news, though. There is an outpouring right now of young, really brilliant minds in universities across the country, I think, and in schools and in high schools across the country who really want to focus on this topic now and are looking to our group to help learn how to do that the way scientists teach each other how to do these things. And we're really excited to have them engaged. And with that, over the next several years, we expect there will now be increasing hundreds and then thousands of young researchers on this, the same way that we need thousands of cancer researchers. We need thousands of researchers focused on this, and it's really important to move that education pipeline along. And that's a big focus of the work that we're doing together.
Yeah, very important. Thank you for that. The next question that we have, your work includes studies of efforts to prevent future firearm injuries by intervening when a teen or young adult comes to an emergency department or even outside of the medical system, such as in schools. Can you discuss what you did and what happened?
Well, I can talk a little bit about the greening work that we're doing and the idea of busy streets. One of the things that we notice is that there are certain kinds of places where people may gather and do nefarious and not so many good things that often may involve firearms or weapons of any kind. And so one of the things that some colleagues and I are doing is looking at what happens in areas of neighborhoods in more urban centers where there's basically vacant lots that become a source of people seeing that, well, we can do negative things in this space. What happens when we start cleaning those up? What happens when we start just mowing them or engaging community in making their neighborhood or their street look a lot nicer? And what happens is all sorts of other positive things occur with people, and we're finding that there are fewer violent incidents, specifically assaults, which are a precursor to gun assaults. We're just now beginning to look at some gun outcomes, but some of our colleagues who've done work in Philadelphia have found that cleaning up lots reduces the gun assaults around that lot, and it doesn't increase in other places, so it doesn't get displaced. Some people say, well, doesn't that just displace where it's going to occur? It's going to occur anyway. And the answer that we have found and our other colleagues have found is no. The answer is no, it doesn't get displaced. It goes away. It doesn't have that place to work anymore. So then we're doing some work in schools where we're doing this mental health first aid kind of work, some procedural justice where kids who engage in sort of negative behaviors and aggressive behaviors have to get back to the community to sort of as their punishment. So as their punishment is engaging in positive behaviors and learning that. We're looking at trying to change school climates, recognizing the sign, standing up to bullies, and creating an environment where people talk to one another rather than alienate and divide each other. So those are some of the things that we're trying to do outside of the clinical settings. But
sure. So I think in emergency departments around firearm injury and then around other types of violence as well, for firearm injury, I think a lot of people don't realize about 70 to 85% of youth who get shot actually go home right from the emergency department, don't get admitted to the emergency department. It's really important that we try to identify youth when they're coming in, both as either as a victim of shooting or as a kid who's at risk, and how we can help them stay safe over the next couple of years. So we mentioned earlier, if you are a teenager in the United States at this point, your most likely cause of death, no matter what I see you for in the emergency department before the age of 18, is going to be a firearm injury. So what should we do from all of our clinical settings to try to help keep you safer? So we've worked for a fair amount of years working on screening and violence prevention from the emergency department, thinking of that sort of as our job, the same way it's our job to recognize kids who might have child abuse, or a woman or adult who might be the victim of domestic violence, and be asking about those questions, to be asking youth a number of questions when they come into the ED or emergency room, and think about what makes them at risk before we just send them back out to the community without anything. And then what should we do while they're there? We have developed some interventions for emergency departments and for hospital systems. One of them is called Safer Teens. We can have the resources on the comment page here, and that we've shown that intervention, if we can identify kids while they're in the emergency department, separate from their doctor visit, not getting in the way of their doctor visit, we can provide about a 30-minute counseling session, and that session decreases their violence and their fighting over the next year. Decrease their dating violence, decrease their regular violence, puts them at less risk by the interaction that we can have with them in a clinical setting. Even a brief clinical intervention like that can really matter for the kids' lives over the year. So I think it's really important to think about the clinical setting as a location to interact with youth, even not just the youth for whatever reason they're there, because again, the thing that they're most likely to have harm from fatally over the next years is something that we can do something about.
Yeah, and I would just add that, a number of the kids who are highest at risk are not necessarily in schools, so they may not get access to school-based programs. So one of the advantages of having parallel clinical programs that can intervene with these kids is that they are showing up in the emergency department, and we do have the opportunity to intervene with them at that time and potentially prevent future injuries. So it's a key setting in which to do this kind of work.
Yeah, thank you for that, Dr. Carter. So we are moving into our final few minutes. Not unsurprisingly, we had a lot of questions on this topic. The penultimate question: what can a parent or grandparent who owns firearms do right now to help their child or grandchild be safer? What can a parent do if they don't own firearms but their child might be going to a home where firearms are present or encountering firearms on the street? It's a big one.
Yeah, it is a big one.
I think it's about firearm access. So I think it's about making sure that firearms that are in the home are secured, safe, away from kids so that they can't access them. Whether that's a younger child or a teen, making sure that firearm is stored safely. And if you're a family that doesn't necessarily own a firearm, but your kid is going to play at another house, it's about making sure that there aren't firearms in that other house.
And asking the questions
And
about
asking
that.
the questions.
Asking if they are, there likely are homes at the other houses
Right.
they're playing, and that's great. And making sure that you have that conversation with the other family who may not used to be having kids come over, and that includes your uncle and your grandfather, and saying, I appreciate that you have guns in your house. Can we just have a brief conversation about how those are stored, where they are they locked up safely? Because my kids are really curious, and even if my kids aren't really curious, I don't know what they'll do if they come across one, and we just want to make sure we need to check in on that. So being just okay asking that question of our relatives. I think it's harder sometimes to ask it of our relatives, asking it both of our relatives as well as all the places where our kids are playing.
And actually, the American Academy of Pediatrics has a nice pamphlet or information on how strategies you can have to ask these kind of questions, because they are uncomfortable questions.
Yeah, thank you for that.
And we keep saying safe storage, so I was just wanted to say what those things are.
That's good.
There's lock boxes that are fingerprint opening, and there's all sorts of technologies around that. There are different kinds of trigger locks. There are strategies of not keeping the gun loaded, keeping ammunition and guns apart from one another. So just to be somewhat explicit about
And I would say
some of the
with that
strategies.
explicit on our website, we have a nice handout that gives examples clearly of all of those, as well as links to where a family can click directly. A lot of local police departments and hospitals give out gun locks and
free gun locks, yeah.
free safety storage devices.
Right.
And I appreciate, you guys have really, at one point you tried to filter down a whole year's research into one question, but we've got about a minute left. What do you hope people take away from today's chat? Where can they go for more information?
So I think the key message to take is that firearm injuries are preventable. It takes resources to figure out what is the best way to do that. We, if they'd like more information on the work that we're doing, we have a website. It's childfirearmsafety.org. and they can go to that website, and on the website it describes all the work that we're doing. It has a number of resources for parents as well as clinicians that they can use or learn about more of the work that's going on.
I'll add just briefly, my one pitch is that collectively we start thinking about this as firearm safety, because it is preventable, and this isn't firearm control, and this isn't gun control, and really trying to move that language away from our culture and really be thinking instead about firearm safety.
If I had one message, it would probably be to say that it's not only about firearms, and we can think about this in the context of other kinds of issues that kids are dealing with all the time. So.
Thank you so much. Thank you, all three of you.
Thank you.
I really appreciate your time. So that's the closing on our chat today. Doctors Cunningham, Carter, and Zimmerman, thank you for sharing your time and expertise with us today. And this will be up on the YouTube channel shortly. Thank you, and have a good afternoon.